Good afternoon. I'm Phil Owen, a peer recovery coach at Communities for Recovery and the Targeted Response Team. Today I have a very special guest. I have Lori Holleran Steiker from the Steve Hicks School of Social Work at the University of Texas. Hello, Lori.
How's it going, Phil? Good to see you.
It's going great. Could you tell our audience a little bit about yourself?
Sure, I'd love to. So I am the Associate Dean of Undergraduate Studies and the Steve Hicks Professor of Addictions and Substance Abuse Services at University of Texas. So I'm excited to be doing the work that I'm doing, and I have my hands in a number of different projects that I'll mention in case anybody wants to follow up and learn more about any of them. In the undergraduate studies, we've partnered up with Student Affairs to create a new program called SHIFT, which is to shift the UT campus around drugs and alcohol. It's not an abstinence-based program. It's a harm reduction program for students to make good decisions, particularly in the midst of COVID-19, being that it's a big stressor and a lot to cope with. So we're working on wellness in that realm. I also am the co-PI with Dr. Lucas Hill on the Texas Targeted Opioid Response Grants that have a number of projects that are related to what I'll be talking about today. The chair of the executive board of the Texas Harm Reduction Alliance, or THRA, and so that keeps me where the rubber hits the road in terms of opioid response. I am also a founder and a board member of University High School and the Austin Recovery Network, which is an incorporation of Austin Recovery and University High School and the alternative peer group Keystone. So that's another realm that I'm active. And right now I'm working on a report for the opioid response litigation for Texas. And so that's also a realm where I've been gathering all of this information that I'm going to be sharing with y'all today.
Great, thank you. So you're
Let me also add, I'm a person in long-term recovery, and I think that that's important for people to know that that's part of my perspective, and that I like to share that as a UT professor to help break down stigma, because I have gotten well from this illness.
Thank you so much for sharing that. You know, that's something we don't ask of our guests to share, but it certainly does make it more personal, and it lets us know how exactly you are connected to all the great movements and organizations that you are connected to.
I appreciate that.
What it brings to mind is you've been to the Austin area opioid work group, you presented there. You know, our focus has always been on the opioid epidemic and what we can do about it to help people that are struggling with opioid addiction, and as well as other substances connected to that. And what it reminds me of is we're all in the middle of this COVID-19 pandemic. But the opioid epidemic has gone nowhere. It's there. It's there, and I'm frightened by the collapse of supports, the inability to be able to social distance, as I also am a person with lived experience, and I know that in my addiction, it was impossible. It would be impossible for me to social distance or physically distance. So I'm frightened by the numbers that we may see going through this and coming out of it. But I'm very glad to have you on the show today so we can talk about opioid-specific service delivery and the ecosystem in which those services are delivered.
Exactly, exactly. So if it's okay with you, I'll just launch by stating that in looking at this holistically, I think one of the best models provided is the SAMHSA 5-spoke strategy of opioid response, which breaks down the interventions into different categories, policy and data being one category, treatment and recovery being a category, prevention being an important category, overdose response as a specific aspect of the work, and then a research spoke, so that we can be looking to what's working and what's not working. So those are sort of what these different pieces of the ecosystem break down into. If it's okay with you, I'd like to start by sharing a graphic. Let me pull it up here. Let's see, hold on. Let me see if I can, hold on one second. I'm just trying to get everything organized here.
No problem, no problem.
There we go. There we go. Can you see that?
Yes.
Fabulous. So this is the community ecosystem, and I would like to do a shout out and encourage people to look for the writings and research and scholarship of Dr. John Brooklyn, who was the person that originated the hub and spoke model. I think it's one of the most brilliant mechanisms for getting what people need in terms of opioid response. So we start in the middle with the medical system. And so I'm going to speak more to the community ecosystem because that's where we live and work. But I want to say that with the MAT services and inpatient and outpatient pain management, things like the ER and the B team, which you've had folks present on from all of those realms. That's a piece in the puzzle. But I also want to call out all of the things that you can see further out in the ecosystem, which people sometimes forget. Corrections and probation and parole, medical homes, family services, mental health services, outpatient treatments, residential services and recovery residences, outpatient opioid response treatment. And I think all too often we forget the whole prevention realm. We can make an impact, and I've been part of a project that's conducted by an agency called Cardia, where we've been educating school nurses and school counselors and school social workers in how to recognize opioid misuse among youngsters in schools, and how to do early intervention and screening, and how to recognize when a student is actually at extreme risk. And some schools are even in a stage of change where they've been ready to disseminate naloxone in their schools. Some of the high schools have that available. One of my students in my young people and drugs class at the University of Texas said that her high school in Texas had a rule that you couldn't put your head down on the desk because there were so many opioid overdoses happening that they were afraid that someone might be overdosing and the teacher would not know about it. So we know that this is touching us and touching us deeply. The other aspect of this that I think we sometimes forget are health campaigns and health promotion. I usually consider the PDMP part of that realm. And I think you've been involved with Mike Mackert a little bit. He might be another person for your podcast if he isn't already, speaking about health promotions with regard to opioids, breaking down stigma and getting out factual information, because of course the myths are quite well proliferated. And then I have a particular interest in these two areas off to the left, one that says outreach and drop-in centers, because I am associated with the Texas Harm Reduction Alliance, who does that work, and also the youth services that have a particular role with opioid response. So I just want to say that outreach and drop-in centers have been evidence-based practices across the nation. THRA is the first established drop-in center for opioid response. Of course, we've had the Austin Harm Reduction Coalition doing syringe exchange and outreach for a very long time. They also do wound care and some HIV and Hep C prevention and intervention work. But in terms of outreach, Texas Harm Reduction Alliance is also doing outreach to the encampments where people are not likely to have access to syringe exchange, and they also may not be in the realm of a drop-in center or be willing to come to a drop-in center. During the COVID-19 era, the Texas Harm Reduction Alliance has established drop points for kits and materials, and so they get picked up and distributed. So what you were saying is true. Very hard for folks in encampments to maintain social distancing, but we can at least get them those harm reduction materials and naloxone and kits, so that should they be in any danger, that they can take care of themselves. So
just quickly, there are a couple of bubbles on here, Lori. Could we, I'm hoping to reach an audience of family members and some people outside our recovery community that may not understand what some of these bubbles are.
Sure.
Caught my attention when you said OBOT earlier. We can go back to that. But quickly, could you let our audience know what an outreach and drop-in center is and how that may help alongside what, say, like the Austin Harm Reduction Coalition is doing in their van? We know the Austin Harm Reduction Coalition is helping with the needle exchange, wound care, and so forth. But what is an outreach and drop-in center, and how might that help in a different way?
Well, I think that the syringe exchange has identified locations where people can come and further their relationships with the recovery community and the folks that work in that realm, and they can also do wound care and whatnot, but it's only reaching the folks that, first of all, can access those sites, and also folks that can that are comfortable accessing those sites. So the outreach becomes very important for folks who aren't more amenable to going to the syringe exchange sites. And it also, we have, as part of the outreach and drop-in center, we have contracts with MAT organizations so that we can do quick induction for Suboxone or methadone, whatever is useful. So it's a really valuable place for people to go if they're ready to make some changes with their opioid use, as opposed to just needle exchange.
So it'd be fair to say we're putting
those services, yeah.
So we're putting a brick and mortar to those services. We're giving an address.
Exactly, that makes sense. One other thing that the Texas Harm Reduction Alliance is doing is they're serving as sort of a clearinghouse and a hub for policy and advocacy work. They've established a webinar that is across the state for folks to start to really build that alliance in terms of changing policy. And so that's something that also the Texas Harm Reduction Alliance does that complements the work of the Austin Harm Reduction Coalition. So they're really in partnership at this point. The one other thing that I want to mention is, and it doesn't have a bubble on here because it belongs to all the bubbles, is peer recovery support services, which I know is near and dear to your heart. We see the peer recovery support specialists as the connecting tissue in this entire ecosystem. When we talk about our dream ecosystem or our ideal ecosystem, it would have peer recovery support services at every one of these locations so that they would be the warm handoff from the ER and the B team to residential services, to mental health services, for folks that need clean needles or Narcan, they could access those. For kids, for families that have young people, they would also be a connection with the recovery high school and the alternative peer groups. They could be outreach to the corrections and probation, the justice system, which they already do a lot of work, I know, with the drug courts and whatnot, and family drug court. So So it's important to say that while they're not listed here, it's inherent. They are the tissue that holds this entire system together, and it won't work without them. The one other piece that doesn't show up on here that would also be the tissue holding all of this together, and that becomes extra critical in a time like the pandemic, is the concept of a digital platform to connect all of these agencies digitally. There's two reasons why that's critical. One is right now, with all of the silos, if there's a family or an individual that wants services and they want a variety of services, because it's very rare that somebody will get all their needs met by one agency, they have to pop from agency to agency, and at every single agency we have an intake form or an assessment, and we've got extensive relationship building that they need to do. Maybe there's not a coordination with their insurance or finances, or what their capacities are in terms of sliding scale. So right now it's kind of a cottage industry dilemma where people are deciding between services, or maybe they haven't even heard about all these services that might be useful for their system of recovery. So what it is I'm going to say that it's our dream and our fantasy, but I'm going to say that many folks are working on this where the rubber hits the road, and there are models for this, like Dr. Casey Claiborne's model, which has been implemented around HIV in Rhode Island, where we could establish a digital platform that would connect all of us with a common consent form, a common assessment, literally an algorithm that would ping the relevant agencies when that particular client system is in need of their services. And it could also be a service that could collect all of our data in terms of who's being served, and so that we could determine the gaps and the strengths of the system and where to lean in. And also it could be tied in with opioid information as well, opioid data that we could fit in with the national picture. So you can see why this digital platform for this entire ecosystem would be such a critical piece, and we're really advocating for that and pushing forward on that. I know Casey Claiborne does have some funding through the T-Tour and is working on this feverishly, and we're hopeful this is not just pie in the sky or science fiction. This is real in real time, and people should be looking forward to that. And hopefully we'll be invited into that over the course of time.
You know, this idea of healthcare functioning as one organism instead of a bunch of little organisms has been a concept for a while, but very seldomly put into use or any approach to it. And when you talk about an ecosystem, it's more of a linear approach where everything's kind of attached. My first question was going to be about universal consents and how do we beat the 42 CFR or HIPAA with regards to confidentiality in that type of system. And you know, many times we talk about how we got to break down the silos and join everybody together as a care team. And
that's right.
Really like this approach. You know, how to make it a reality, and certainly the agencies that you're attached to have that kind of ability to try to, you know, research and see this thing through. So I'm so glad that this is what we're talking about today, because I truly believe that oftentimes so many pieces of the puzzle are left out.
I agree with that. And I think that it's nobody's fault that happens. We're all running a mile a minute and really putting all of our resources, our time, our energy, our blood, sweat, and tears into all of our agencies, especially in these challenging times. It is my belief that we will be at some point getting some of this opioid litigation response money, because there's no doubt that the damage has been done, and we're looking forward to having this ideal system out there, so that the funding goes to all the agencies that need it. I worked really hard and pulled together focus groups of people to make sure that everything on this ecosystem that it's pretty comprehensive. But I trust you and your group, and we're still in this process. So if there are viewers that are saying, holy moly, she totally missed the boat, she missed X, Y, or Z, this is still a work in progress. I would love to hear from people as to their thoughts about things that might further enhance this opioid response. Let me also name a couple of things that are not in my particular report, if that's okay.
Sure.
Let's see. Hold on, let me just get to where I need to be to take a peek at it. Okay, here it is. Let's see. Here we go. So I want to name some other things that are being addressed in this ecosystem discussion that are outside my purview, but now that I've said, you know, let us know if I'm missing anything, let me share with you what the comprehensive plan includes. So for prevention, we're talking about public education programs, including a public campaign to educate regarding the risks of opioid use, billboards, TV spots, digital and social media, influencers, engaging community organizations, and recovery supports. Healthcare provider education programs, school-based education programs, college-based education programs like OperationNaloxone.org, pharmacy disposal mechanisms for excess opioids, hotlines for professionals in the event that they have questions, so like resource centers, data monitoring systems, alternative treatment modes, such as for folks with chronic pain, things like biofeedback and alternative therapies, Narcan distribution and training. Then the pipeline to treatment will be addressing jail screenings, pregnancy screenings, court referrals, syringe exchange, ER teams, hospital teams, EMS, which is an important component in this system. Of course, they're also connectors. And let's see, for treatment, I've spoken about the hub and spoke. We're even talking about counselors to ensure referrals within the justice system, intensive outpatient, residential therapy for those that need it. Let's see if there's anything else. Oh, pre and postnatal recovery housing for women, grief therapy because people have lost people to the opioid epidemic, NAS baby and maternal counseling. Mobile MAT is part of the vision for the future. Health information systems, Narcan distribution. Let's see, what else? A learning collaborative for education and training on the administration of MAT. I know that we've been leaning into educating, for example, recovery homes in MAT provision. Let's see, developmental follow-up for enrichment for NAS and maternal mortality reduction, evaluation teams. Let's see. Anything else? Criminal justice reform, specialized training with lawyers, increased jail funding for substance use related services, training of law enforcement officers, and let's see, and that's what I've got for now. So that's a pretty exhaustive list as far as I can imagine, but like I say, we're still in the process of designing this dream ecosystem, and if you have thoughts or ideas, or your viewers do, I would love to hear.
Well, I think it's evidence to show that a lot is being done about it, but there's still a lot more to do. Just right off the top of my head, I think of families who struggle, that have a hard time getting connection, and then you mentioned the court systems. I'm a huge advocate and have a huge passion. I really hope one day to get peer services connected with pretrial services.
That'd be amazing.
There's so many things to go on, but thank you so much for being here.
Such a pleasure.
Really excited to have you on the show. And I just want to say, Lori Holleran Steiker from the University of Texas, Steve Hicks School of Social Work, thank you so much for being here.
My pleasure.
Thank you for viewing and tuning in. And be safe, carry naloxone. I'm Phil Owen for Communities for Recovery. Have a great day.